This is Scott Halstead. I'm greeting my friends and colleagues in the Philippines, and I'm here today to talk about dengue and the dengue vaccine. When I was at the Rockefeller Foundation a few years ago, I was the founder of the Children's Vaccine Initiative, and after I retired with funding from the Rockefeller and Gates Foundation, I founded the Pediatric Dengue Vaccine Initiative. So I've been in the dengue vaccine business for a long time. In fact, in 1960s, I was the lab chief in Bangkok and was the person who first discovered that it took two different dengue infections, a sequential dengue infection, to result in the disease we now call dengue hemorrhagic fever. In those days, of course, Philippine hemorrhagic fever, or H-fever. So dengue is a big problem. It's a huge problem in the Philippines, and I understand that. And you are the first country to purchase vaccine at a mass scale, and I know that you would like to use it most effectively and the most ethically, with the best outcome. So we're here to talk about dengue. Now, dengue is a really unique virus. It's not like measles, mumps, rubella, or any of the other conventional viral infections. As you recall, there are 4 different dengue viruses, and it takes 2 different dengue infections in sequence to result in severe disease. But more than that, and even in the Philippines, you have seen the tragic fact, unique to dengue, that infants that are born to dengue immune mothers, and usually those mothers have 2 or more dengue infections, those antibodies alone can sensitize infants so that they have the same severe and sometimes fatal disease, the dengue vascular permeability syndrome. So this is what makes dengue so unusual, and trying to make a dengue vaccine against a virus that's so unusual poses really unique problems. And we can see that the Dengvaxia, the vaccine licensed by Sanofi, has not succeeded in totally protecting everybody. This vaccine is unique, again, among all the viral vaccines, in that it's a so-called chimera mixture between yellow fever and dengue viruses. And the structural genes of the 4 dengue viruses have been inserted into the backbone of yellow fever, 17D. And what that does is it presents the immune system with just the structural proteins. Now, we've learned, partly since Dengvaxia was first conceived, and with a lot of really wonderful data, new data, showing that protection in dengue requires a combination of antibodies and T-cell immunity. And the problem is that T-cell immunity in dengue is only derived from the non-structural proteins, which are present in an entire dengue virus, but they're not present in Dengvaxia. That the non-structural proteins in Dengvaxia are all yellow fever. And yellow fever immunity does not cross-protect against dengue. So it's not a surprise, unfortunately, that when the Dengvaxia was given to young children, 2 to 5-year-old children, some right in the Philippines, they were not protected, they got infected, and in fact they were hospitalized, and their hospitalization rate was 5 to 7 times higher than in the control group. So this is a vaccine which, when given probably to seronegative individuals, produces non-protective antibodies which are enhancing. And these antibodies, just like the passively transferred antibody from mother to baby, actually make the very, very first dengue infection a person ever has to be, instead of very mild, very severe. And those are the facts. Now, Sanofi is saying that this is a problem only for 2 to 5-year-olds and not for 9-year-olds, but that's not biologically sensible. 2 to 5-year-olds and 9-year-olds all respond on a continuum from, it's age dependent. The younger children are more susceptible to vascular permeability syndrome than our older children, but older children are certainly susceptible. So we can expect that seronegative 9-year-olds vaccinated and then infected with dengue are going to develop a disease, in some cases severe disease. In Sanofi's own trials, almost 2% of vaccinated children vaccinated at 9 years old and then infected, 2% of them who were infected were hospitalized. So, sorry, it's more than that. But at any rate, the point is that there's real data from the 35,000 person clinical trial that Sanofi has published that shows that 9-year-old children are benefited if they've had one prior dengue infection, but they're also at risk. So how can we use this vaccine sensibly? Well, Sanofi has shown us in published data that when given to somebody who's had one or more dengue infections, the Dengvaxia boosts the immune status and is fairly protective. That's wonderful. So I have been saying for many months now that it's fairly simple what we should do. We should pre-screen these individuals. Everybody says, "Oh, that's impossible. There's hundreds of thousands and millions." Well, this vaccine is an artifact of public health. It's something that we've constructed, and we can construct a test. There are tests already on the market, just simple fingertip tests that give you a result in 20 minutes. And this is what I suggest should have been done. Sanofi should have sponsored this. The WHO should have agreed to it. And it's something that you need to discuss very carefully in the Philippines, because, as you remember, Hippocrates swore us all who practice medicine to do no harm. First, do no harm. And what we've learned is that if you're seronegative and your very first dengue infection is going to be very trivial, but if you get vaccinated, then your first dengue infection may put you in the hospital, and it may be worse. So this is a vaccine that is doing harm, but it's doing harm in a way that can be avoided, and that's what I think we should be doing. Now, I realize you've already gotten started with a mass program. I encourage you to study the cases that have been vaccinated very carefully. We still need to know much more about who gets protected, who is specifically at risk, what do the 4 different dengue viruses do, or do they have a different outcome? So there's a lot to be done, and I hope, of course, I wish everybody in the Philippines well. I hope this program will go forward in a sensible way and provide the kind of protection we'd all like to see. If I can be of help in any way, please do let me know. I'm more than happy to discuss ideas that I have for both learning more about how this vaccine works, how it can be used properly, but also to design a cost-effective and ethical vaccine program for the Philippines. Thanks very much.